the recording. I'm going to hand over to Dr. Ilja Kruglikove, who's the founder and owner of Wild Comet and the brains behind LDM TRIPLE. We have Martin Rowe from Aesthetic Medical Partners with us as well as our partner here in the UK. So I'm going to mute, sit here in the background, and we'll hand over to Ilja. So with great pleasure, handing over to yourself. If you want to just give a little bit of an intro and then obviously go into the presentation. Thank you.
Matt, thank you for your presentation, first of all, and for your invitation to give this lecture. Ladies and gentlemen, good evening from Germany. This will be not the usual lecture because, first of all, we will have a lot of material, a lot of new things. And this lecture has two parts. Without understanding the first one, it will be difficult to understand the second. Because of this, the first part will be the dermatology and aesthetic medicine with LDM TRIPLE scientific background. I will try to do it as simple as possible, but it is urgently needed because the majority of you have no idea about it. I am very sure many people didn't hear about these discoveries which happened during the recent past. Let's start because we have a lot of discussion and we will need our time. I am the CEO of the company Wild Comet. I have the PhD and Doctor of Sciences in Medical Biophysics. I was in the active science for many years, and they made a step aside to the industry. We developed the new technologies on the basis of scientific investigations we're also doing. We have altogether, I have more than 150 scientific papers and more than 50 of them in the field of dermatology and aesthetic medicine. Maybe this is the main thesis. If at first the idea is not absurd, then there is no hope for it. Albert Einstein. You will understand later what I mean. It is really crazy what happened during the last decade in the field of dermatology and aesthetic medicine. It is even more crazy. The majority of the people in this field don't know about it. We have two new hallmarks in dermatology and aesthetic medicine that were intensively investigated during the recent decade and which serve now as the universal targets for different applications in these fields. This is very important to understand. One, you can make so many successful applications with one and the same treatment method. For some people, it is unbelievable. If you will understand the first part, you will know what we're talking about. Which discoveries I mean? The first one is the discovery of dermal adipocytes. And the second one is the discovery that the caveolin-1 membrane protein is one of the main, but not the main target in inflammatory, hyperproliferative skin conditions, and also in skin aging and treatment of chronic wounds. First, I will only shortly show what happened after discovery of these two new hallmarks. If I say we, I mean me and my scientific co-author, Professor Philip Scherer. Philip belongs to the 1,000 best scientists of the world. He discovered adiponectin. He is the professor on the University of Texas and the director of the Touchstone Diabetic Center in Dallas. This is the biggest diabetic center in the United States. Which pathophysiologies were modified during the recent years? You see only our publications. The whole theory of photoepilation was urgently needed to make the complete revision from the point of view of selective photothermolysis, which was wrong, pathophysiology of acne, pathophysiology of psoriasis. On the left side, you see the publication in Nature Aging Mechanism of Diseases. Because all of these publications have the impact factor altogether. All these publications, I show you, have the impact factor above 200. Cutaneous scarring. You see another publication in Nature Journal, Cavelin as a target in prevention treatment of hypertrophic scarring. Skin aging, androgenetic alopecia, cellulite, lipodema, and the very new pathophysiology, physiology and pathophysiology of the white adipose tissue, which was published in Nature Reviews Endocrinology and the recent publication of April this year in Obesity, which completely changed our viewpoint on the development and modification of the adipose tissue. We will start with the first hallmark. We should talk about this to understand what we can do, why this is important, and what can we do. We are talking about the so-called dermal white adipose tissue. The abbreviation is DWAT, and this is really not only the new hallmark, this is also a very important target in dermatology and aesthetic medicine. The number of publications in this field growing exponentially. And beware, from the very beginning, from the year 2000, our first publication was 2014 about this. And we have altogether something like 10, 12, maybe 14 publications, I don't know, about this issue. What we are talking about? To discover in the 21st century the new type of the tissue is the same as to discover the new island. On the left, you see the mice skin. This is a publication from Nature for a very good scientific group of Gurera, Juarez, and Vadim Pilkus. You see the structure of the mice skin. Generally, this is epidermis, dermis, this is what you know. Then we have subcutis, maybe. Then you see the muscle. The name of this muscle is panniculus carnosus. And under the muscle, you see once more the adipose tissue. For a long time, it was believed this is only the muscle in between, nothing more. Later, it was very clear the structure of this adipose tissue, of the top adipose tissue, superficial adipose tissue, it has different names. The structure of this tissue and the function of this tissue sufficiently, maybe substantially, influence the behavior of the skin. Moreover, these cells are not stable. They steadily transform from one state to another, from adipocytes to fibroblasts. For a long time, it was not clear whether the same structure really exists in humans. The problem was we don't have panniculus carnosus. So it was very difficult to differentiate between the superficial part of adipose tissue and deep part. Normally, if you will see it from the anatomic point of view, it is separated by humans by fascia. And this is the superficial fascia. In different areas, the name of this fascia is different, but it's still the same. We have the very reactive and the very special layer. It is not very thin, but very important. You see our two publications. They were published in Trends in Endocrinology and Metabolism. This is one of the leading journals in the field of adipose tissue, concerning the dermal adipocytes from irrelevance to metabolic targets and the role of immature and mature adipocytes in hair cycling. What we are talking about. Without these cells, and they are on the distal end of the hair follicle, they are located on the distal end. Without these cells, you don't have any growth of the hair. If you delete the cells, the growth will be stopped, the hair shaft will fall out, and it will be over. This is one of the reasons for alopecia. This is also the reason why after this discovery, and as I said, it happened 2014, it was urgently needed to make the modification of the photoepilation based on the selective photothermolysis. The real reason for the stop of the hair follicle growth is not the selective photothermolysis. This is the behavior of these cells. They are strongly involved, dermal adipocytes are strongly involved in wound healing. If you will consider the non-wounded skin, wounded skin on the second day, fifth day, and seventh day, you will see the so-called perlipin plus cells. These are the adipocytes. This is a marker of adipocytes. These adipocytes, dermal adipocytes, must appear in the wound. Without this appearing, the wound will be not closed. The next example is very important. This is the so-called reactive adipogenesis. It was not known before that such phenomena exists. What you see, picture A on the top, you see the normal skin, white line, small white line are these dermal adipocytes. Now you put in this skin Staphylococcus aureus, gram-positive bacteria. It is normally always present in the skin. This is the commensal bacteria. But if you increase the concentration of this bacteria, it will be pathologic. And look what happens. Immediately on the day one, from this thin layer, you have this layer of dermal adipocytes. On the day 3, it is full with dermal adipocytes. The reason for this, during differentiation of pre-adipocytes into adipocytes, they produced the antimicrobial peptides, which work against the pathogens. And this phenomenon was named reactive adipogenesis. And you can see during hours, let's say 1 day, maybe 2 days, this is a huge modification of the whole structure of the skin. Instead of dermis, you have now a lot of adipose tissue. The next example is very important. I cannot go in the depths of what happens here. I have a separate lecture for this. It was done by a very good group. Also, Philip Scherer is here, but this is the group of John Varga. John Varga is one of the best, when not the very best man in the field of systemic sclerosis. What you see here is the application of bleomycin, injection of bleomycin in the skin of the mice. Left is control, right after application of bleomycin. On the day 5 after application, you see sufficient reduction of the adipose tissue. White points here is the dermal adipose tissue. Red is the panniculus carnosus. In control, it will be stable. But after application of bleomycin, on the day 21, you find no adipocytes. The reason is adipocytes made the so-called transdifferentiation. They transform their phenotype to myofibroblasts. And myofibroblasts produce fibrosis. This is what you see on this bottom build to the right. This tissue is also very strongly involved in skin aging. You see the young mice, middle-aged mice, and old mice, and you see the development of the adipose tissue. This has a very important reason. I will talk about this reason a little bit later. But what happens with increasing age, dermis is reduced. This is from our publication in Aging Research Reviews. And yellow is the dermal fat, it is increased. And these two layers is a bilayer of the same structure. That means the reduction of the dermis, which is observed during aging. The reason for this reduction is the increase of the dermal adipose tissue. Now you see our publication in Journal of Clinical Investigations. I name you the journal only to show you what we are talking about is extremely serious. This is the Journal of Clinical Investigation. This journal is number 2 after Nature Medicine. What we have done here, this is our publication. You see me, Philip Scherer here. This is his laboratory. It was demonstrated in this publication that dermal adipose tissue change its content and volume during the hair follicle cycle. It goes down, it increases the volume, and so on. And this corresponds exactly to the hair follicle cycle. It looks like this. This is also our picture from our publication. These are the dermal adipocytes. Dermal adipocytes during the catagen phase of the hair follicle cycle is dedifferentiated, change its structure and function to fibroblast-like cell. This is so-called pre-adipocyte. It happens during catagen. During anagen, you have the reverse process. There's a redifferentiation from these cells. You will receive the adipocytes. This is a reason for the photoablation, but not only for the photoablation, for many things. Because during this dedifferentiation, this cell lose the fatty acids from inside, and they are placed in the extracellular space. And the fatty acids produce the inflammation. It happens exactly around the hair follicle on the distal end. This is the reason for acne. It can go further. More than 90% of all the cells are in this cycle, but some cells can transdifferentiate further from the fibroblast-like cells into myofibroblast cells, and then we will have the development of fibrosis. This is also a reason, for example, for acne. This is the reason for scarring. This layer has a lot of properties. One of these properties, very important properties, it produces much more collagen than the normal adipose tissue. SQ is the subcutaneous adipose tissue, deep adipose tissue. DVT is the superficial adipose tissue. And this is the comparing relative expression of different collagens in these two layers. And you see in the superficial layer, it much higher this expression. In this case, for example, 3 times. So you can selectively change the stiffness of this layer, which is the way to make the anti-aging treatments. You will see it later. Now we must stop with this, because if I give the whole lecture, the full lecture about the dermal adipose tissue, it will take something like 2 hours. We must stop. And we will now continue with the second hallmark, which was discovered during the recent past. And we will also strongly involved in this development. This is the caveolin worm. This is some of our publications. The first 2 Nature journals. This is experimental dermatology. Altogether, we have 7 or 8 publications in experimental dermatology. This is Aging Research Reviews, the number 1 in aging research field. And this International Journal of Molecular Sciences. And you see caveolin is a universal target in dermatology. In 15 minutes, you will understand what I mean. This is the cell. You see the membrane of the cell, and normally we consider the membrane of the cell as a smooth structure. If you will amplify the picture, you will see this is not correct. Everywhere in cell membrane, you have such omega-formed invaginations inside of the cell. For a long time, it was not really clear what they are for. Later, it was supposed this is the reservoir of the volume. If the cell must quickly change the volume, then it has only two possibilities. The first one, it must produce new membrane. It will take a long. The second possibility, it will use this reservoir and make the structure smooth so it can readily and quickly react, for example, for the hypoosmotic shock. Later, it was clear all this was wrong. These structures are responsible for signal transduction processes and the process of endo and exocytosis. And from this moment, it was clear how wrong was our understanding about different processes we have in dermatology. How it looks. This is one caveola. Caveola came from cave. And you see the yellow structures is the protein named caveolin 1. There are three types of caveolin, caveolin 1, 2, and 3. 3 is only in the muscles. We will not talk about this today. Caveolin 1 and 2 are in the majority of the cells in the skin and other tissues, but we are talking about the skin. But caveolin 1 is the protein which is responsible for the structural stability. Without caveolin 1, there are no caveola. Here in this case is a big concentration of cellular receptors. They are not distributed homogeneously on the surface of the cell. They are concentrated in these structures. Which receptors are there? Transforming growth factor beta. This is the master regulator of collagenesis. So all what happens in dermis, in the skin with collagen, is dependent on these structures. Matrix metalloproteinases, that means not only what happens on the surface of the cell, but also outside of the cells in the extracellular space is dependent on these structures. Heat shock proteins, the stability of proteins which are produced by the cell. Hyaluronan receptors, distribution of the water between the inside and outside of the cell. Toll-like receptors, master receptors for inflammation. Glucocorticoid receptors, and what is very important, etc. Let's look how it works. I will show only very small number of examples. It will not work today, but to give you the impression how important is it. First, we will talk about the collagen, because this is one of the main points for you, because you are working in the field of aesthetics. How it works with collagen. To make the stimulation of the cell to produce the collagen, you need the substance which is named TGF-beta, transforming growth factor beta. These molecules are coming from outside, and to stimulate the cell, they must go through the channel which is known TGF-beta receptor, two-part channel. So far, so good. The problem is, if the concentration of caveolin is very high, then these receptors will be trapped into the caveola, will be internalized through endocytosis, you will see it later, into the cell, degraded there, and after the cell cannot react to the stimulation with TGF-beta. This is the reason why we have the loss of collagen in skin aging, because in skin aging, the concentration of caveolin is very high. If we can reduce caveolin, we have the possibility to shift the production of collagen, to increase the net of production of collagen. Another example. Here you see the disruption of cholesterol with a substance which is named methyl beta-cyclodextrin. With this substance, you can destroy the caveolus, only caveolus. What happens? Tremendously increased production of interleukin-8. Now it is considered as the main reason for atopic dermatitis. If you consider the correlation between heat shock protein 70, this is the main heat shock protein, which is responsible for the stability, check of the stability of proteins, and caveolin 1, you see the linear correlation between these two. We talked about the different receptors. Now let's talk about their skin conditions. What happens in different skin conditions? First, psoriasis. This is our publication. You see in this picture, HS, this is the normal skin. These are the psoriatic plaques. You see in psoriatic plaques, it is strongly reduced. The level of caveolin in inflammatory skin conditions is generally strongly reduced, with some exceptions. You see a very good work which was done by the group of Ivan Josic from the University of Miami. We're also working together. And you can see here in pustula psoriasis, plaque psoriasis, in palmoplantar psoriasis, and nail psoriasis, the concentration of caveolin is very, very low. This is a reason for inflammation. In other two types of psoriasis, guttate psoriasis and inverse psoriasis, the situation is different. It is unchanged. But every dermatologist who dealt with these two diseases really know they're classified as psoriasis, but these are not the psoriasis diseases. If you will consider what happens with psoriatic skin and other skin conditions, inflammatory skin conditions, if you apply the glucocorticoids, and this is the first line of treatment by inflammatory skin conditions, you will immediately see it increases caveolin. And this is the reason for the improvement of the skin. This increase correlates with the state of the skin. Stop with psoriasis. We are talking about scarring, another publication of ours. And you see normal skin, normal scar, keloid, not lesional skin, and keloid lesion. The same situation, almost the same situation by hypertrophic scar. Almost nothing is here. This is a big reason why we will publish very soon a very new pathophysiology of hypertrophic scarring and keloids. If you will consider different treatment methods, the accepted treatment methods for the treatment of keloids and hypertrophic scars as mechanical stress, supraphysiological temperature, corticosteroids, pleomycin, fluorouracil, tranilast, umicoimod, botulinum toxin A, hyaluronidase, and so on, all of them increase caveolin. The problem, systemically, is a big problem, can make the side effects. Also by application locally can make some problems. What is about the caveolin in skin aging? This is our article. This is a dramatic situation. This is in young subjects, and this is in old subjects. And you see the difference is really dramatic. Moreover, if you will now consider, this is also from the group of Ivan Josic, if you will now consider what happens with increase in aging, this is caveolin, the bottom line, you can see the increase of caveolin, the first step of increase of caveolin happens with 30-35 years. This is the beginning of aging. The next step happens by 60s, but the first is here. That means if you don't want to have the problem here, you want to start with treatment here in the early age. What about the caveolin in wound healing? This is really a dramatic story. First of all, I would like to show you this is not the problem of skin. This is the general problem. What you see is the corneal epithelium after application of laser surgery. The first graph demonstrates you the wound healing time for the young people, middle-aged people, and elderly people. The second graph shows you the concentration, the expression of caveolin in membranes. And if you put both together, relative density of caveolin and wound healing time, you will see this is a linear dependence. With increasing caveolin, the healing time will increase. We have two big reviews, our reviews, but I show you another review also from the group of Ivan Josic. This high value of caveolin is typical for diabetic foot ulcers, venous leg ulcers, pressure ulcers, decubitus. And if we can make with some treatment methods, you will see later which, down regulation of caveolin, the result will correlate with healing time, with the closure. I not need to discuss here. We will discuss now what happens in the acute wounds and what happens in chronic wounds. And these are two absolutely different stories. The only thing they have together is the name wound. All other is absolutely different. This is the acute wound. You have the normal value 0 before the damage of the skin. This was the surgical damage. And the first reaction is a strong reduction of caveolin. This is urgently needed to give the keratinocytes the possibility to enter the wound. Without this, it will not happen. And then during the next time, the level of caveolin will recover. But you see, it recovers slowly. That means we have the possibility to improve the healing of burns if we accelerate this process. You will see the pictures in the second part of the lecture. The situation is, however, absolutely different if we are talking about the chronic wounds. By chronic wounds, the concentration of caveolin is extremely high, especially at the edge of the wound. And because the concentration is very high, the cells will build a barrier for keratinocyte. They cannot enter the wound and cannot make the epithelialization. This is the main problem. Why is the concentration very high? Very easy. Because by these wounds, we have the high production of cortisol, stress hormone. And cortisol, you see the glucocorticoids have the same effect on the caveolin. That means increase of caveolin. And in chronic wounds, through increased concentration of cortisol, you have very high level of caveolin. And look now what happens. What these people do or did. If we know how it works, we can apply the unusual drugs to treatment. In this case, they applied for treatment of chronic wound, the diabetic foot wound, they applied mervastatin, which is normally used for diabetes. You see what happens? Tremendously reduced caveolin several times and strong acceleration of healing process. If you know what you are doing, you can do remarkable things. Now, caveolin and acne. This is our article in Experimental Dermatology. I will show you only the indirect result. This is the application of 30% supramolecular salicylic acid pill. This is the gold standard in application of drugs in acne. And you see brown color is the histochemistry of caveolin. This is the coloring of caveolin. You see before the treatment and after the treatment. You see very clearly the increase of the expression of caveolin. this expression of caveolin correlates with improvement of the skin. Now we are coming to the treatment concept based on these two things, on these two hallmarks. This treatment concept was named caveolator. We have, by different inflammatory skin conditions, psoriasis, acne, I can add lichen planus, normally very difficult to treat. Some other diseases, atopic dermatitis. By hypertrophic scarring keloids, by worn bones, the concentration of caveolin is lower at the physiological level. Opposite to this, in skin aging, chronic wounds as diabetic ulcus, ulcus cruris venosus, decubitus, wounds by old patients, and so on, the concentration is very high. But what we need is the middle value. If you would like to make the treatment of the broad spectrum of applications, we must have the possibility to increase from here or decrease from the right to the middle. How it works? You show the table what happens with different gens if you apply the mechanical stress in the form of high-frequency ultrasound waves. If you will look carefully, you will see this is caveolin docking protein, or mechanoreceptor is another name. It strongly reacts to mechanical stress. And you see this is the highest fold ratio. So increase is the highest exactly here, because this is the mechanical effect. So we have the possibility to do it. Additionally, if you make the supraphysiological increase of the temperature, what does it mean, supraphysiological? This is the hyperthermia, but a low one, the weak one. In this case, you see from 37 degree to 40 degree. This is caveolin, and you can see the difference between this and this. In other words, if you apply the low-level thermomechanical stress, either mechanical stress or thermic stress, you can increase. But if you will apply high intensity, you will decrease. And this is the possibility to differentiate different conditions in their treatment. Why it works this way? You see it here. This is a flat membrane. If you decrease the tension on the membrane, you will form the caveolus. If you increase the tension on the membrane, you will remove the caveolus, and you will remove also the caveolin. Moreover, if you use different intensities of ultrasound, this is approximately 1 watt per square centimeter, 2 watt per square centimeter. These are the values which are given in the science, 170 kilopascal or 290 kilopascal. You see by 170, this is a relatively low level. You go down and then up. By 2 watt per square centimeter, by higher intensities, you go down when you are down. So you can increase or decrease. Moreover, we can influence this process not only through the intensity, other way, very high intensity will be needed, and they're connected to possible side effects and other problems. But we can change the mechanical stress through application of different frequencies. And for higher frequencies, the application, this is higher frequencies, this is 10 megahertz, this is 1 megahertz. For higher frequency, the stress for the cells will be higher. In this technology, which will be presented to you today, we use so-called triple ultrasound waves. 3 waves in one of different frequencies. And these frequencies are changed very quickly between each other. Penetration depth of these waves is also very different. For 19 megahertz, you have something like 1.5 millimeters. You are strictly in the dermis and on the boundary dermis subcutis, in the face at least. By 10 megahertz, you have 3 millimeters. That means dermis and subcutis. By 3 megahertz, you are very deep, you are in subcutis. By 1 megahertz, you are more deeper, you are in a muscle tissue. And you see now the distribution of the energy. If you use different frequencies, if you use 10 megahertz, you will have in the depths of 1.5 millimeters, the absorption of 43% approximately. And by 19 megahertz, it will be 66%. That means this is 50% more absorption. This is my article in AIP Advances, AIP, the American Institute of Physics. And this article was published 2017. And we wanted to modulate and demonstrate which mechanical stress and temperature stress we can produce in the cells, the application of this method. If you use the frequencies of 3 megahertz, this is the bottom line, green line is the 10 megahertz, and blue line is the 19 megahertz, you see the temperature surely increases with frequency. But what may be more important, you see the temperature gradient. This is the difference between the temperatures. And on the boundary, dermis, blue, subcutis, yellow, you see the knick. And this is the highest temperature gradient you have by 19 megahertz, lower by 10 megahertz, by lower frequencies, almost nothing. What does it mean, temperature gradients? You have the heat flow. What is this for the boundary? This is dermal white adipose tissue. So you can influence the dermal white adipose tissue, not only with mechanical stress, but also selectively with a heat flow, because it happens exactly on this boundary. We use these frequencies with very quick exchange. So this is the triple LDM, 3, 10, 19 megahertz, for example. We use the frequencies 3 megahertz, 10 megahertz, 19, 3, 10, 19. And this happens in milliseconds. Starting from 1 millisecond, you can change the frequency. Why it is important? Because the cells in the tissue cannot react to a single mechanical stress if the time of stress application less than approximately 200 milliseconds. From cell type to cell type, it will vary a little bit, but it is in any case, it must be much higher this time than the time of change we use here. What does it mean for the cells? The cell cannot differentiate between the different waves. It must react to all 3 waves together as one package. This effect was named biological interference. You can make the same if you use 3 different sources, and they will be collimated in one point. But this is first very expensive, and second, this will be just one point. Here you can use the surface with this trick. And the stress for the cells will be the highest by triple, lower by dual wave, and of the same intensity, and even lower, the lowest for the single waves. That means we can increase the cell stress without changing the doses, making the treatment side effect free with this trick. The device we are talking about, and you will see now in the second part of the lecture, you will see a lot of different applications in different fields, is a device for development of thermomechanical stress for regulation of caveolin and dermal white adipose tissue, using the frequency 1, 3, 10, 19, 2 triple applications, 1, 3, 10, and 3, 10, 19, 5 dual applications. This was just a short introduction to the topic. to give you the possibility to understand what happens now. Other way, it is not clear how it's possible to make with the same treatment method so many applications. Now I should change to another presentation. And we are talking about the clinical applications of LDM triple in dermatological and aesthetic conditions, as well as in skin longevity. A little bit later will come the skin longevity, but the main point, these treatment methods we use, they don't make any harm. This is the regenerative treatment method, very exactly applied. And because of this, you can also use it for skin longevity. That means to make the skin longer, healthy. Skin longevity, skin-related healthier aging is becoming an integral part in dermatology and aesthetic medicine. These treatments, which belong to skin longevity, can be preventive or regenerative or curative, and they are applied both to pathologic and healthy skin. To increase the acceptance of treatment, they must demonstrate relatively quick and strong outcomes, which will satisfy both the patients and the doctors. And what is very important, to sufficiently improve skin longevity, this treatment must demonstrate the long-lasting results. All these points we will discuss during demonstration of every new type of application. We will start with inflammatory skin conditions. This is my article about skin longevity with explanation how it works, what should be done. It was published in Kosmetische Medizin. This is the German journal, the main German journal in the aesthetic field. We plan to translate it to English. It was already translated to different languages, also to Korean language. But we plan to translate it to English. So if you want, you will receive it from Matt in the future. We will start with this study. Before I will start with demonstration of results and explain you the results of the study, I should say, you will see the results from different countries. That means the results obtained on different types of the skin. You will see the Asian skin, you will see Caucasian skin, Arabic skin, and so on. Everywhere, at the end point, you have the similar results, but the way to this similar result can be a little bit different. The quickest way will be by Asian skin, because it has another structure. So you will need not so many treatments, less treatments. And how it really works, I will show you on one very specific example a little bit later, as we will talk about eczema. I will show you the so-called picture gallery after every treatment to show you the evolution, and will explain how it generally works. This article, this study, was published in Journal Cosmetic Dermatology. The evaluation procedure was global evaluation of Atlas scale, modified global evaluation of Atlas scale. This is GEA. The baseline scoring by all acne patients involved in this study was 501. The average before-after improvement of the skin after in average 6.5 sessions was 73.7%. And after the last treatment, it was 90.1% during the follow-up. This is already remarkable. After the last treatment, you have 73% improvement. And during the follow-up, and you will see the patients up to 19 months after the termination of the treatment, you see the further improvement. Doesn't mean that you will not have the patients which react with a new inflammation. Surely possible. But in general, the situation is this. This means that repair and generation processes induced by application of the triple frequency LDM waves continue after completing of the treatment schedule, making the treatment remarkably stable. You see the single results and the evaluation. You see the percentage of improvement. What is very interesting, you see the average values of this GR score before, after, at the end of the treatment sessions, and in the follow-up. You see the further improvement, and this is statistically highly significant, very highly significant, unusually highly significant for medical application. The reason for this, 9 independent dermatologists assessed the state of the skin. And you see by every dermatologist before and the end of the treatment session and in follow-up. That means this confirms the high visibility and robustness of treatment outcomes, because all knowing dermatologists could recognize the same trend. Surely it's a little bit different because everybody will assess it a little bit more hard or a little bit weaker, but the trend is very clear. Now look the pictures. This woman, before the treatment, had 456, and you see not only the acne, this is acne tarda, the age acne, but you see also the scarring. After 12 sessions with triple, and this is 8 months follow-up, I can say this state was altogether approximately 14 months. I don't include this result. After 14 months, he received the outbreak. But 14 months, even 12 months, even 9 months is the unusual time. Another example, initial scoring 411, after 5 treatment 0.67, and 6.5 follow-up 0.22. Next example, before 4.33, after 8 sessions 1.11, 4.5 follow-up 0. Remarkable case, before 6.33, after 6 treatment 2.11, after 9.5 months follow-up 0.67. Before 5.67, 3 months follow-up after 6 LDM 0. Now I will show you a really very interesting case. This is not acne. It will be always misdiagnosed as acne, but this is the rosacea papulopustulosa. Altogether, follow-up was 12 sessions 2 times per week, and follow-up was 10 and 19.5 months after the last session. This is before the typical case of rosacea papulopustulosa. And this is after 8 treatments, and this is 10 months follow-up. And this is 19.5 months follow-up. You see, it will be worse, but uncomparable with the initial result. This is always the same. Even if the patients will have the outbreak, it is weaker, much weaker. Another important case, because this patient had a pregnancy in the first trimester, you have almost no possibility to make a treatment. The reason for this treatment was that the effect of the LDM is a local one. You have only effect where you make the treatment. That means if you make the contralateral control, one part of the face will be treated, another will be not treated. You will have the result only on the treated side. Because of this, and because the face is very far from gravida uterus, it was possible to make the treatment. Altogether, 3 weeks, you see here the picture, 3 weeks after 5 sessions. And this was till the maternity, the same state. It was needed for the patient to make additional treatments. She was fully satisfied. And now this special case, what I would like to show you, because now you will see the picture gallery. You will see one session after another, how it works. And this is a big reason for this, why I show you this example. Patient, female, 33 years old, finger exam since the 2013. First appearance of on the left leg, 2019, followed by the right leg in the same year after onset of pregnancy. Topical medication provided some improvement without stable results. Contact dermatitis to the nickel alloys. Treatment was done 10 sessions, 1 time per week. Follow up 6 months after the last session. Altogether, we had the results now up to 12 months. This is the begin before the treatment. Then you see after the first treatment, please consider the evolution. You see some evolution, but normally it happens not much. If you see the patient only every several days, you will forget how it looked before. So for the patient, for the doctor, this is not really a big evolution. This will be for every condition. After 2 treatments, after 3 treatments, it's still there. You see the change of the quality, but it is still here in the same volume. After 4th treatment, after 5th treatment, after 6th treatment, 7th treatment, and now we have reached, with the 8th treatment, we have reached the critical volume. And for every treatment, it will be, for every patient, for every customer, it will be the same story. I discussed it just 1 week ago or 2 weeks ago with one very famous dermatologist from Singapore. He had very difficult case of diabetic foot, and it was not closed after 10 treatments. It can happen. The critical volume wasn't reached. The reason for this could be you must, in the beginning of the treatment sessions, to accelerate them. That means to make more than 2 sessions per week, maybe every day, the first 3-4 treatments. It will help enormously. But if you reach this state, this critical state, after this, it will be transformed immediately, overnight. This is what you see here. After the 9th treatment, you don't see. Now you can compare. This is before, and this is control 6 months follow-up after 10 LDM triple. 12 months later, she came once more with very small spots, approximately 3-4 square centimeters in the both legs, which disappeared after 3 sessions. But the remission during almost 1.5 years, this is really the excellent results for everybody who knows how it works with exam. We have also another retrospective eczema atopic dermatitis treatment with LDM, which demonstrated the average before-after improvement of the skin of approximately 67%, with a very high significance by evaluating doctors. You see the results. This is a Dr. Mayer-Roger, one of the biggest dermatological practices in Germany. You see atopic dermatitis after 3 treatments. And now we will talk about another application. In this case, this is the exanthema, skin rash. And the story is very, I don't want to say unusual. Sometimes it's really usual if you have the wife which is working in aesthetic field. She is the husband, and his wife is the doctor, medical doctor, and she would like to try with him. So first she used the exosomal injection, but he didn't really know what to inject. Then a little bit later, two weeks later, she applied to HIFU and CO2 laser to improve the results. What happened this year? This is before the first treatment. In this condition, we receive the patient. We are the ambulance. For the people who are working with these devices, they are the ambulance. You will see a lot of these cases now. If the doctors don't know what to do, they send to those who have these devices. So you see clearly the skin rash. This is before the second treatment. This is before the third treatment, fourth treatment, and then abruptly the improvement. And now you can compare. This is before for the fourth treatment and before the fifth treatment. It's over. Didn't appear anymore. Summarizing, LDM triple is an effective treatment option in generative treatment of inflammatory skin conditions, different skin conditions. It demonstrates highly significant skin improvement just after 3 to 8 regular treatment. It's not needed to prolong it. If you have the result, if you reach this point, if you have your experience, it's not needed to make more. It is better they will come later to make the supportive treatment. Treatment results are stable and normally further improve after the treatment is finished, as demonstrated in follow-up controls. Now we are going to hyperproliferative skin conditions. What you see is a burn scar. Before, after 4 LDM treatments, after 9 treatments, and this is 3 months follow-up. Now the opposite side, because this is really the difficult case, the opposite side of this patient. Before, after 4 treatments, after 9 treatments, 3 months follow-up. What is here important? By this surface of burn, the appearance of hypertrophic scars or even keloids is highly probable. But what we see, if we properly and in time start to apply this treatment and really regulate the production of caveolin properly, we don't have the scarring or we have very mild scar. This is a curious case. That was the complication after lipofilling in temple area. Why the people doing this, I don't know. And the patient received the embolism. The vein was closed. What happened? No blood flow in this area, wounding, development of the scar, and through the scar, development of alopecia. I don't show you the whole development of this case. Surely we documented all the stages. This is 1 month follow-up after 11 treatments, and this is 3.5 months follow-up after 18 treatments. Clear improvement of the scar and regrowth of the hairs. Postoperative scarring. Before, 2 years after breast reconstruction of pay, after 6 LDM. Hypertrophic scars after abdominoplasty. Before, approximately 2 years after abdominoplasty, after 10 triple, 1 time per week. Another case, before, also approximately 2 years after abdominoplasty. They didn't have the devices. The devices appeared in this city later, after 10 treatments 1 time per week. This is another case presented by Professor Park. Professor Park is the chief of the Society of Aesthetic Plastic Surgery of South Korea. What they have in this case, this is the complication in the form of granuloma formation after application of PDO threads. The rare condition, but what should you do if you have it? Surgical operation, removal, didn't produce a success because it appeared once more. So what they did, they removed and applied LDM. We have a lot of these pictures. The problem I have no enough time to demonstrate this because we have another topics to discuss. But in the end of this lecture, I will show you something special and we will discuss maybe for the future if you will be interested in. So the LDM triple is an effective treatment option in cutaneous scarring tissue fibrosis. I didn't show you, for example, the fibrosis, also the results from South Korea. They have a lot of investigations. These machines are staying in all 16 universities of Seoul. Demonstrate highly significant skin improvement just after 8 to 10 regular treatments. Treatment results are very stable and normally further improve after the treatment, and I strongly recommend to apply for prevention of scarring after burns and surgical intervention. Clinical application of LDM triple in skin longevity for skin hyperpigmentations. There are different ways to do it. I am every year in Asia with lectures, normally in Seoul, with 200 to 300 doctors. For 2 years, I was in Singapore, made a lecture there. And I was in the praxis. They have 6 hour machines. They use picosecond laser to make the treatment of skin hyperpigmentation. And they, after treatment with this machine, they have so many patients, they do nothing more. This is the post-inflammatory hyperpigmentation after dermatitis artifactum from Korea, before and after altogether 5 treatments. This is the hyperpigmentation is one of the biggest dermatological practices in Korea, the practice of Boggimin, all for skin. And this is very interesting case because it demonstrates how it can work in longevity. You see the melasma before, after 8 LDM triple treatments 3 times per week with application of tranexamic acid. If I don't show any drugs, then that was a treatment only with the machine. If I show some drugs in combination, then they will apply. What is interesting here is the bottom line. A reduced appearance of melasma at the patient go in the sun after the treatment course. 1 year later, this patient came back. Every year she received melasma after going in the sun. And after this application course, it was very slight. And they see this, the people who specialized on the treatment of melasma, they see it, the majority of patients. Now we are coming to the huge field. Correction of side effects after filler injections and aggressive aesthetic treatments. It's not enough that you can make very successful treatments of the skin. You can repair the side effect which was produced by other people. The problem is the number of observed side effects after injection of fillers or application of aggressive aesthetic procedures tremendously increased after Corona-19 pandemic. I have really no time to explain you why, but we have 3 very big publications concerning Corona in different big journals, including Life and Obesity. And the situation is a little bit different. Was presented in the literature and the media. We have the activation of the complement system. This is the internal immunity. Remaining damages connected with chronic inflammation, fibrosis, or tissue loss can lead to a persistent impairment of the skin, which will sufficiently influence skin longevity also in the future. This justifies the application of treatment methods which can remediate the problems and regenerate the skin. What can we do? No matter which filler that was a panic. Really, I show you really the difficult cases. Because the simple cases, no problem. We are talking about the difficult case. You see the injection in the nasal label fold. This 1 day after injection. 2 days later, it was very clear there is a problem. It was a hypoxia. You see it here. Maybe the development of necrosis. 1 day later, it was very clear. In this condition, 5 days after injection, the patient came to us. The doctor, the well-known plastic surgeon in Germany, called me and said, "Can you help?" Here we started the treatment. Altogether, you can see the evolution here. Altogether, there were 4 LDM triple sessions and 24 Skinova med. Skinova is a special device. We don't talk about device here, but this is the device which the doctor can give to the customer or patient to make the home treatment, to support the main treatment. 24 Skinova means 2 weeks. Because the treatments will be done twice a day at home. This is the end result. And I can say you, she should come a little bit earlier, not on the day 5. Then this development of this small scar could be prohibited. It was removed with other method, with CO2, but the general development is surely clear. The next case is a complication after application of hyaluronic filler in chin area. Embolism after hyaluronic filler, after 6 procedures, 3 months follow-up. What is very important, if the patients have the pain will be reduced after 1-2 treatments, or disappear after 1-2 treatments. This is a difficult one. To repair the complications after filler injection in the lips is extremely difficult. You see here 1 after hyaluronic injection and after 1 LDM triple. You see here another case. This is also another question why the people doing this, but this is before, after multiple hyaluronic injections. This is after 1 application LDM triple, after 2 applications of LDM triple. We can. Complications after IPL. We have hundreds of cases, hundreds documented cases. This is burn, 2 months follow-up after 12 treatments. This is chemical burn by application of the high concentration of retinoic acid before, after 2 LDM, after 3 LDM. Generally saying, this method is a very effective treatment option in correction of side effects after fillers and aggressive aesthetic or dermatological treatments. And this method demonstrates quick and highly significant skill improvement without any complications and is highly accepted by patients and customers. Clinic wounds and skin grafts. This is for the surgeons. If you have any here, I don't know. Chronic wounds, such as diabetic foot, ulcus cruris, decubitus, significantly influence the quality of life of the patients, especially by old patients, and have a dramatic impact on their longevity. post-traumatic, post-operative skin grafts, which by large damaged skin surfaces demonstrate often a bad survival or no survival at all. This is one of the few indications where the dermatology and aesthetic plastic surgeons can directly influence not just the skin longevity, but rather the general longevity of their patients. You see the first case, diabetic foot, and you once more see the evolution of this foot before the first treatment, third, fourth, sixth, seventh, ninth, closed, without scarring. Remarkable case because this is sacral decubitus. By sacral decubitus, you don't have the tissue to make the treatment. The volume of the tissue is very low, very small. This is before, and this is after 5 LDM triple sessions in 13 days. We have a lot of these cases, very popular, for example, in Asia. You see the study published by the group of Professor Park, and you see the different skin graft operation 6 cases with results assessed as good, excellent, good, excellent, 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 and application for radiation-induced ulcer. Now look which difficult cases can be treated. So that was breast reconstruction by radiation therapy patient, cancer. A, after 4 sessions, after 14 sessions, after 37 sessions. It was no chance for this patient. They tried several times to make the skin graft. It didn't survive. Even more severe case, after melanoma, before, after 6 sessions, and after 19 sessions. This is very effective treatment by treatment of chronic wounds. As I said, we have the clinical studies for chronic wounds. We don't have all the time to discuss it today, but we have a lot of clinical results for the wounds. In any case, the wound closure tremendously accelerated or increased the life quality of the patients and their general longevity. Now we are coming to cellulite. And what I will show you now and explain, this is a very different viewpoint on the cellulite. By the way, also lipodem. But this is not just cellulite. This is cellulite and skin tightening. The effect is the same. You will see why. First of all, we should discuss what is wrong with cellulite. Cellulite is not just an aesthetic problem, but is also associated with development of negative psychosocial effects in affected individuals, sufficiently reducing their quality of life. You see our publications with Philip Scherer, where we developed the new pathophysiologies of cellulite and lipedema. A little bit later, this year, we published a big article with genomic and proteomic analysis of lipedema cellulite patients, which fully confirm the proposed pathophysiology. But what is very important, it is very highly likely, very probable, that cellulite and lipedema represent the consecutive stages of the same process. Cellulite is the early stage with a high prevalence, and lipedema, which much lower prevalence, is the progressive stage. That means, can you in time improve cellulite? You can reduce the probability of lipedema, at least in patients with obesity. What is the problem? And what was done new? You see the pictures obtained in Korea with ultrasound diagnostic device operating with 20 megahertz. What you clearly see here, white line is epidermis, green is dermis, and black is subcutis. Now please look to the right side. The stiffness is the lowest in subcutis and the highest in epidermis. So the white color is the highest stiffness, green color is the next level of thickness, yellow is the next one, and black is the lowest one. What you clearly see here are the invaginations of the adipose tissue into the dermis. These invaginations, they have special reason. Exactly this line, exactly this junction, dermal-hypodermal junction, this is the junction where the dermal adipose cells are located. And these cells can grow and penetrate into the dermis. Then you will see the pressure from inside to outside, and you will see the projections of this pressure on the surface of the skin at the cellulite lumps. This is before, and this is after 10 LDM triple. What you clearly see, tremendous improvement of the dermal-hypodermal junction, almost no penetration of subcutis into the dermis, and strong improvement of the stiffness of dermis and epidermis. That means if you have also the rest pressure from inside to outside, it will be withdrawn by higher stiffness of the tissue. And that means altogether, the three factors, they will lead to a tremendous improvement of the skin appearance. This preliminary study was provided on 6 patients, and you can compare now the results. The upper line is before, the bottom line is after. So you have compare up, bottom, up, bottom, up, bottom, and everywhere you see the same. The improvement of projections of the adipose tissue into the dermis, improvement of the stiffness of the tissue, and that means the general improvement of the optical skin appearance. In accordance with this, we did a longitudinal case report, 10 series clinical study to evaluate the clinical outcomes of application of triple ultrasound. The assessment was provided with 2 different methods. The first one was a general one. This is what is generally applied in this field. This is a so-called clinician-reported photonumeric cellulite severity scale. This is the most modern severity scale of cellulite we have now. Patient satisfaction was evaluated using the 10-grade JACE. This is the General Aesthetic Assessment Scale, ranging from 0 to 10, 0 dissatisfied, 10 fully satisfied. And additionally, and this is the most important thing of this study, we applied the so-called real-time compression elastography at baseline and during follow-up. And you can, with this method, you can visualize what happens with the stiffness of the tissue in different depths of the tissue, of the skin. The average improvement, you can see here, this is the single patients, this is the average improvement before the end of the treatment session and during the follow-up. You see the same story. Further improvement after you stopped the treatment. That means it is very probable that we have the long-lasting results. Sonoelastography allows the investigator to make the so-called elastic scores. And if you compare these elastic scores before and after, and it was done for 6 different regions: gluteal left, gluteal right, lateral left, lateral right, femoral left, femoral right. And they were compared by 6 independent dermatologists. You can clearly see the significant everywhere where you see the asterisk. This is whether the significant 0001 or 0002. This is extremely unusual for medical trials. The results: before, patient number 3, 41 years old. Before, after 10 treatments, follow-up 17 months. And now the sonoelastography. It looks like this. You can see here on the right corner, upper corner, you can see which part of the body was investigated. It was every time the same part, the same point. So this is before and this is after. And you see the upper part of the skin. And this is the fascia. That means from here you have already the fat tissue. It is tremendously reinforced. This is the reason, and this is follow-up 6.5 months for this. You cannot make the same follow-up for photonumeric pictures and the same follow-up for sonoelastography. It doesn't work. You cannot organize this in one process. But this is 6.5 months after the end of the treatment. You have such a state in the skin. No wonder that we have such a result. This is another part. In this case, this is the gluteal area. Here we have the femoral area, and here we have the gluteal area. And you once more have the tremendous improvement of the stiffness. Second case, patient number 4, 39 years old, follow-up 70 months. Once more, you see tremendous increase of the stiffness in the upper layer. That means even if you still have the pressure from inside to outside, you will not see it on the surface. The same for the gluteal area. Next case from this study, patient number 5, 28 years old. Before, after 10 treatments, follow-up 11 months. Before and clear after 9.5 months after the treatment. To give you the feeling how it works normally with celluloid, if you compare the conventional devices, what happens with the skin, you will see the results start to disappear after 3 months. This is the general rule by celluloid. This is out of this rule. Next case, pinched. That was relaxed till now. Now I show you the case with pinched. Patient number 10, 47 years old, before pinched, after 10 sessions pinch, and follow-up 3 months pinched. And this is the improvement of the skin, the same point. Patient number 11, this will be now very interesting. This patient, you see the pinched picture before, after 10 sessions, follow-up 4.5 months. By these patients, altogether there were 3 patients with this treatment. This patient received the contralateral control. That means left leg of the patient was treated with triple LDM 1310 MHz, and the right leg was treated with 310 and 90 MHz. Also triple, but more superficial absorption of the energy. And now let's compare. The first 4 pictures, this bottom, let's talk about the bottom line. The first 2 pictures were done with 310 and 90 MHz, more superficial absorption. If you will compare with 310 MHz, You will still see the improvement, but it's much more strong if you apply 3, 10, 19 megahertz. This is at a mixer. You mix the skin and make the skin after mixing very strong, very hot. This is why it is much better to use for application the frequencies 3 to 19 megahertz. This is the difficult case of the patient 12, 52 years old, after 10 treatments and follow-up 3.5 pinched. And once more you see before and in follow-up. Patient number 1439, follow-up 5.5 months. All of these patients will now receive 15 months follow-up. We have already 15 patients. We need 18, and then we will publish the upgrade to this study. But I can say you, almost no one of them was worse. Surely it will be. Sometimes it will be worse, must be. Before pinched, after 10 sessions, follow-up for 12 months. Patient number 17, 35 years old. Before pinched, after 10 sessions, follow-up 4 months pinched. And this is the picture. This is very clear that you have the reduction of cellulite with this picture. And this is in gluteal area of the same patient. Patient number 18, before, after 10 sessions, follow-up 4.5 months. And this is the sonelastography. You see everywhere the same. This is the explanation why it works. Altogether, LDM triple is very effective in cellulite reduction. Its effective application can significantly improve the patient's quality of life. Treatment outcomes are long-lasting, can improve further after the treatment has finished and demonstrated in follow-up controls. And this long-lasting improvement of the skin cellulite can positively influence the probability of lipedema development and thus directly improve the longevity of the patient. Anti-aging and skin tightening. As I said before, I'm just in time. As I said before, now you will be very surprised, but there is a direct connection with what happens with the skin, laxity, and what happens in cellulite. This is the reason why. You see the publication from the Shizeda group. This is very good laboratory. The chief of this laboratory is the Dr. Etsura. And this is what they published recently. We have the same results. We also published these results, but for the skin, so clear. They published it better. The graphs are better. Because of this, I showed these graphs. You see the number of infiltrations of the fat into the dermis by young and all patients. You can see it here. This is the proximity, the distance between the top of the penetration and the epidermis in young people. And this is the proximity between the top of the penetration and the epidermis in aged people. And you see it tremendously increases. This is absolutely the same story. I can explain you what happens. We have 3 publications about this with experimental data, very strong publications, which demonstrate if fat tissue penetrates dermis, and you have the transformations of this tissue, because this is the dermal white adipose tissue, and you have the transformation, then dermal adipocytes make the fat drops free fatty acids, and they force the fibroblast instead glucolysis use the free fatty acid cycle, and from this moment the cells will be senescent. It was demonstrated in this experimental study, which we published in Experimental Dermatology. So the story is the same. The tool to work against this is also the same. if we can reduce the penetration, we can improve the skin type. Let's look. Before, please look on the contours of the face. Before, after 8 LDM treatments, 1 month follow-up. After 3 months follow-up, I cannot explain you why. By this tremendous improvement, she did hyaluronic acid filler. From this moment, we cannot continue with her because we cannot differentiate between our results and additional results obtained with hyaluronic acid. This is the reason why you see here maximum 1 month. Skin tightening before, after 10 treatments. Look to the contours, look to the nasolabial fold, look to the structure of the skin, look to the chin. And this is the same story. This is the sonoelastography before, after. This is the customer with a typical loose partial, this is named partial facial lipodystrophy. You can see it clearly here in the malar area, in the middle area of the face, after application of HIFU. They have hundreds of this thing. This is before. This is after 10 applications of LDM triple, and this is 1.5 months follow-up. This is also HIFU. You clearly see the local lipodystrophy before, after 10 treatments, before, after 10 treatments, 2 times per week. This is the lipodystrophy after application of aggressive radiofrequency with needling, microneedling. Before, after aggressive RF microneedling treatment, after 10 treatments. And now, the interesting thing, maybe you know about this, maybe you don't know about this. We have a big problem in the field. This problem is named Ozempic face. This is not only just a problem of Ozempic as a drug. This is a problem also of other treatment methods, bariatric surgery, for example, where the patient demonstrates a quick, rapid weight loss. Why? I cannot show you this article. It is under consideration, a very good journal. It will be published, I think, I hope, in 2-3 months. The reason for this is a non-proportional reduction of the fat in the face comparing with the total reduction in abdominal area and other compartments of the body. And the difference is huge. In the face, it is up to 40, even 50% reduction. In the whole body, 10%. I will not comment it right now, but we have a problem, especially if you use such applicators as GLP-1 receptor agonists, which are very popular now in the population. Everybody, many people are doing this. If they do it for a long time, for a longer time, they will have this structure of the face. So this is after 10 treatments, and this is 2 months follow-up. Here you see the same story, weight loss of 17 kilos, and this is after 6 treatments. The mechanism is very similar with cellulite, so we can do both of them. Main benefits of the LDM triple. What I don't show you now is the application in aesthetic plastic surgery. We have a lot of applications in aesthetic plastic surgery by blepharoplasty, by facelifting, by liposuction, by abdominoplasty, and so on and so on and so on. But we have really no time for the first presentation to show you these results. I will make a proposal later, and then we will see whether it will be interesting for you. So we have a very broad spectrum of applications in dermatology, aesthetic medicine, aesthetic plastic surgery. Generally, every customer which will enter, or patient which enter your door can find, in your practice, can find some application with this method. This method provides a physiological regulation of inflammatory hyperproliferative processes in the skin without any known side effect. A little bit redness directly after the treatment in several minutes disappears. Unusual long-lasting treatment results compared to other aesthetic treatment methods confirmed in long-term follow-up studies. High level of skin tightening and skin rejuvenation without any negative effect on skin longevity. Strong regenerative effect of treatment allowing effective correction of side effects provided by different aggressive treatments, and preventive treatments for skin remediation with the scope of the skin longevity concept of welcome. That was for this presentation, but maybe not for the future. I make a small sneak preview, and then you can discuss it later with Matt. Maybe it will be interesting to do something like this. I have a series of lectures which are given in different countries, from Australia to China, Singapore, Korea, Japan, so Europe. These are these lectures. In these lectures, we can in detail discuss what is the new pathophysiology, new understanding of acne, what is the pathophysiology of wound healing, pathological scarring, cellulite, skin aging. These are the 5 lectures which I give at a lecture series, and surely with applications of LDM as a method to treat. This is also not the whole story. The second part is this one. I have published approximately 10 years ago a series of articles in Kosmetische Medizin in German language concerning the controversies in aesthetic medicine. This field is extremely controversial. You see the paper concerning the simply sigillum veri of the fetal epilation, neocollagenesis, which is surely wrong, cellulite, body contouring, skin tightening methods, cryolipolyzed, and treatment schedule, which is very important and normally is not discussed, but it is extremely important to have the good results. Maybe this is also something for the future to make the further education, if you are surely interested in. For today, I think that was enough for you. That was, I don't want to make more, because it different understand from the first time. I know this. Maybe it will be needed to make it in a separate lectures once more, or repeat it once more. I know this. If you hear this for the first time, difficult to believe and extremely difficult to understand. But if you want to work with the future of the medicine, not with the past, it is urgently needed. Thank you very much for your attention.
Thank you, Ilja. Really appreciate you taking the time, and thank you for everybody that has joined and is still with us at this point. Highly informative. If anybody's got any questions, please drop either Martin or myself an email, and we will follow up with Ilja and respond back. But highly informative. And yes, I think sometimes mind-blowing and a lot to take in, because it is definitely a new way of looking at how to treat skin on a truly cellular level, which I think not many of us are familiar with at this point in time, especially across the UK and Ireland. So thank you for taking the time. Thank you for just putting some of the small information that is in your head and that you've produced, Ilja, to us. So we really appreciate it.
Once more, thank you very much for your attention, for everybody that spent this evening with us together, and I wish you a nice evening.
Thank you.
Thank you, Ilja. Thank you.
Bye-bye.
Thank you. Have a good night, all. Thank you very much.
Thank you.
Thank you. Bye-bye.
Bye-bye.